Hi everyone, I am Dr. Andi. It is time for today's Facebook Live, always my favorite day of the week. While I give all of you the opportunity to log on and join today, I'm going to give a brief introduction into who I am, a little bit about my background. So I am a naturopathic physician. I've been practicing in Toronto, Canada for about 12 years now. My focus and my primary focus in practice used to be more so sort of sports medicine. I was a dancer, I was a personal trainer, but now my background, I focus more so on metabolic nutrition, fat loss in my patients as well. I do a lot of hormonal balancing, a lot of hormone replacement therapy for my patients. And then we work a lot in the anti-aging regenerative medicine space. We also focus quite a bit on cognition, cognitive decline, working with those who are sort of reversing or preventing Alzheimer's is also a really big focus of ours as well. So really the foundation of that for our practice is the low carb keto standpoint. We really focus, I personally have been keto for about 12 or 15 years now. It's something I've done in my personal life, and then I introduced that to my practice as well. And so obviously it was a really big and significant change, being able to introduce exogenous ketones for those patients who weren't really able to make the changes, so really engage in a ketogenic diet. That was a really big and significant difference, or those who are looking to optimize keto as well. Like I said, I was keto for quite a few years and I was able to start introducing exogenous ketones. So I will start, I'll get right to your questions. I'll answer as many as I can. I know I always miss some, but I will try and get back to them. But I thought I would start today talking a little bit about digestion. I've had quite a few keto consults in practice this week and specifically today. And one of the biggest questions I get a lot is about digestion and digesting fat. What happens if you're keto, you're not able to break down fats, or if you have problems breaking fat down and so you're not able to consume sort of the avocados and things like that. And so the biggest and most important thing is making sure, because I would never ask somebody to adhere to a low-fat diet ever. Every cell in our body is made from fat. Our brain is made from fat. It needs those fats as that primary fuel source. So the primary thing I'm asking people to do is really just support their digestion. And I've had quite a few questions this week about gallbladder function. How do you go keto if your gallbladder is not working, or if you can't digest fats appropriately? And then how does that impact exogenous ketones? And so the biggest thing is always to make sure that you're taking a digestive enzyme with ox bile in it. That's the biggest thing if you're having challenges digesting fats. And the thing with exogenous ketones is that gallbladder function doesn't really play a role in the absorption. You don't need it for the digestion. So you can absolutely still take exogenous ketones even if you're having some gallbladder issues and your body sort of struggles in general to break fats down. Best advice for someone that has a hard time adhering to low carb. So there would be a couple things I would ask you there. Is the hard time adhering to low carb, oftentimes we have a little bit of food addiction. Our food and our sugar sources have been made so, like the composition of them is so that they do become addictive. And that's why so many people have challenges getting rid of them and taking them out of their diet. It's so much more than just willpower. You just stop eating them. So you have to look at a few things. So you have to look, is there a little bit of an addiction there that needs to be managed? You have to look at your history as well. I was mentioning willpower, and we know that there is something called willpower fatigue, and willpower, if that's all it took for people to cut carbs out and unhealthy food out, it wouldn't really be that much of a struggle, because so many people are really committed and they're just not able. And we know that a lot of it has to do with neuroplasticity and sort of how our body has mapped, or how our brain has mapped our desire for sugar. So for example, as a child, at the end of the day, you'd go home at 4 p.m. from school and your mom would give you a cookie. Now your brain knows at 4 p.m. you eat cookies. And so that's just what you do. And so now as an adult, you walk around the workplace and you're looking for a little sweet treat, something like that. So you have to look at the reasons and the contributing factors to why you're wanting those foods. And that's also very important when you're starting to cut those things out. And then once we've sort of dealt with some of those things, I slowly start to introduce the carb reduction. So the first thing I do is intermittent fasting. So you're just not eating breakfast, and that's usually a really easy thing to introduce. And then for people who are new to keto, I just say just pick a meal that has a carb in it. So intermittent fasting, you've got 2 meals left in your day, only one can have a carb, lunch or dinner. If you want to have pasta for dinner, then you have to have a healthy carb-free lunch. And that's a very easy transition for most people. It doesn't feel restrictive. It's not telling them you can't eat all these things you used to eat. You're really just saying not having breakfast, and then pick the meal you want the carb and the other meal can't have it. So you don't feel like you're depriving yourself. And I feel like that works quite well for my patients, and that seems to be a really easy way for them to slowly start integrating a lower carb lifestyle or low carb habits into their life. And then of course, if it is a food craving or addiction thing, we know that beta hydroxybutyrate has been shown to assist with that. It does play a role in our leptin and ghrelin. So there could be a role once you introduce the ketones that might help as well if those are food cravings that you're having. It might help as well to decrease those food cravings. So there are quite a few things that you have to look at. But again, don't sort of beat yourself up or be hard on yourself, because again, it's not all about willpower. Sometimes it's about, rewiring our brain that's been programmed to do certain things. So there are a lot of things that can go into that. Can I still eat carbs if I drink keto? Yes, absolutely. That really is one of the primary benefits of exogenous ketones. Is that for those who don't want to go keto, can't go keto, want to still keep carbs in their diet, the question is, can I still benefit from exogenous ketones? And yes, absolutely you can. That's really one of the primary benefits, is that you can absolutely consume your exogenous ketones when you have carbs, and your body will still get the benefit of having ketones in your system. And our body, our muscles specifically, will choose its fuel source. So what we're finding is that heart, brain, muscle actually will choose ketones when given the opportunity and when exposed to both. I have COVID and I'm really hungry and craving carbs. I've been 20 grams or less a day for years and lost 80 pounds. Well, that's fantastic that you've lost 80 pounds. What I would say is don't be hard on yourself during COVID. There are certain periods and times of our lives where certain things have to be adapted and adjusted. So you have COVID and your body is just saying, I'm needing a few more carbohydrates in here, and that's okay. Just make, we can always make healthy carb choices as well, add in some extra fruit, something like that. It doesn't mean you have to go straight to unhealthy carb sources. And so if during this time your body feels like you need a little bit of more carbs, then feel free to do that. People will also find, if they're sleep deprived, for example, that they crave some more carbs. So there are certain periods of time where your body just wants some more carbohydrates. And I'm a big sort of proponent of listening to what our body is telling us. And so if your body is sort of at a point where it's saying, I'm not feeling well, I needed some more carbs, then go ahead and do that, and then go back to keto afterwards. And then see if you can just sort of introduce, again, if there are those carb sources that you're looking for, see if you can introduce some of those healthier carb sources, so sticking with fruit, berries, things like that, and then just go back to keto afterwards. And I find that that's a really sort of a really easy transition. And some people need to move into a more cyclic, or what I call sustainable keto. Not everybody is going to be full keto forever. And that makes it really challenging for some people, the idea that they can never eat a carb again for the rest of their life. And that's not the case. You absolutely can eat carbs. It's not that you have to cut them out of your life forever. And so I call it sustainable keto, which is that you just sort of cycle in and out of keto. And so you have, 1 or 2 days a week where you're higher carb, or you like, or you have pizza with your family and you enjoy, and then you just go back to keto, maybe do a longer fast the next day to help get your blood sugar and your insulin back under control, and then go back onto your keto diet. And I'm actually seeing some questions about insulin resistance, and intermittent fasting is really one of the best ways to get our insulin under control. The longer the fast, the greater the decline in insulin that we see. That sweet spot for the decline in insulin, it hits at about 16 hours with a really big burst at 18 to 24 hours. So usually what I'm recommending to my patients is 16 hours every day, twice a week, anywhere between 18 to 24 hours. If you can get to 24 hours, that's great. And then you'll see really great benefit on insulin, decreasing those insulin levels. And then beta hydroxybutyrate, there's some great research there as well, looking at the role of BHB on insulin blood glucose levels. So there's some overlap and benefit of those two practices as well. And we also know that the fasting can help turn on autophagy and mitophagy, and beta-hydroxybutyrate has been shown to do the same thing. Ketones in liver, AST and ALT levels. So I'm wondering if you're asking, is there, I don't know if it's a benefit or harm to the liver and your liver enzymes, but following a ketogenic diet or taking exogenous ketones should not negatively impact your liver or your liver enzymes. So if you're seeing a rise in your liver enzymes, it's not likely due to your diet, not likely due to ketogenic diet, not likely due to exogenous ketones. We often see elevated liver enzymes, ALT, when there's fatty liver. Fatty liver is caused from elevated carbohydrates in the diet, not elevated healthy fats in the diet. So that's a bit of a misconception. So if you have been diagnosed with fatty liver, what you need to follow is a low carb diet. So if you have fatty liver, you need to go on a low carb diet. That should help bring those liver enzymes down. There's more that you need to do there. I'm assuming you're working with your doctor in that case. That's how you found out that you had some issues with your liver enzymes there as well. But exogenous ketones, ketogenic diet should not increase liver enzymes. So there's something else going on there as well. And then the third liver enzyme, GGT, if that's elevated, then we're looking at sort of more alcohol impact on the liver. So there are a few other things to look into that as well. But ketones and ketogenic diet will not cause elevations in your liver enzymes. I'm in kidney failure. I'm sorry to hear that. I'm doing high protein, low carb, no salt, and you're trying. So that's lovely, Sarah. I'm so sorry to hear that, but love that you're sort of introducing some of those practices. I talk quite a bit about a conversation I had with my nephrologist. I also have kidney disease. I have polycystic kidney disease. And so I've been keto for quite a long time. And the last visit I had with my nephrologist, because I see her obviously multiple times a year, and I've had PKD since I was 18 years old. And so the last visit that I had with her, she was mentioning that the latest nephrology conference was all about the ketogenic diet. And so it was speaking to the nephrologist, about keto and the benefits that beta-hydroxybutyrate can have with respect to kidney function. And so she brought that up in our consult and asked me if I knew much about the ketogenic diet and fasting. And so I said, yes, I do know him. And so it was really interesting, actually. It turned into almost an hour-long consult with her just firing all these questions at me. How do I do it? How to introduce it to patients? She was really excited about the research that had been presented. And so she had a ton of questions about, introducing fasting, introducing the ketogenic diet. She was really interested in exogenous ketones. So it was a lovely consult with a nephrology specialist who is very open to keto, but also great to learn that nephrology conferences are now starting to present keto and the benefits of keto with respect to kidney disease and how that can support their patients as well. So there's some really great research coming out in that space. So sending you lots of positive energy, Sarah. So sorry to hear what you're going through, but that, again, lovely that you're making some of those changes, and hopefully your nephrologist is also on board. How can ketones help with insulin resistance? So I touched on that a little bit earlier. Ketones and skin. So there's some interesting impact that ketones can have on skin, ketogenic diet and exogenous ketones. When somebody comes in with any skin condition, eczema, psoriasis, even acne, all of those things, there are certain things we want to look at, but things like eczema and psoriasis, we know that there's an inflammatory picture there. When we look at acne, there's inflammation, there's microbiome dysfunction, same with eczema, same with psoriasis. There are some things going on in the gut that we need to balance. And so the first thing we're wanting to do is make diet modifications, taking out the inflammatory foods. So the keto diet is really helpful for that. And then we know that beta-hydroxybutyrate has been shown to improve gut microbiome, encourage the production of healthy gut microbiome, and all of those things are connected with the skin. And then again, we know that it plays a role in our inflammatory cascade. So for some of those inflammatory conditions, again, like eczema, psoriasis, there could also be some benefit there as well. So there is some interesting research looking at the benefits with respect to skin. And then also the MCT oils, those are also quite helpful when we take those as well. So that's part of the changes we would make with respect to improving skin in general. But yes, there could be benefit there. Can you have ketones on a carnivore diet? Yes, absolutely. Carnivore is another version of keto, essentially. So on a carnivore diet, you're most likely going to go into ketosis. And so yes, and absolutely, you can consume exogenous ketones really on any diet that you're following. But again, you'll see benefit if you're following carnivore, if you're following keto diet. What I have found with the carnivore diet is that men, seem to respond better to carnivore than women. I find that women need to cycle through carnivore. They can do it, then they need to sort of cycle out. I see a few more hormonal disruptions on carnivore diet for women. So there is still benefit there, but I find that women can't stay on that diet long term. They've got to cycle out of it. But again, I find that men have see more benefit when they're on a carnivore diet. But yes, absolutely, you can take your exogenous ketones if you're a carnivore. I'm having a hard time getting back to a strict diet. You've lost 60 pounds. You've kept it off for 3 years. That's fantastic. You had surgery in May and you gained back about 8 pounds. So definitely hard to get back to things like that. I know it's tough when you feel like you've fallen off a little bit. The surgery for sure. So there are other things underlying there that you want to make sure that you're addressing. I'm not sure what you had surgery for, if that was a significant stressor for you. Do you have elevated cortisol levels now that need to be managed a little bit? Because cortisol, our stress hormone, is also a storage hormone and will cause weight gain and fat storage. So that's something to look at as well. And then, of course, obviously the stress surrounding the surgery. So those are some things to manage. And then also my tip is always just to sort of do slow and steady. You don't have to dive right in and be sort of hardcore right off the bat. Just baby steps, small changes to get you back towards your goal. So whether that's just introducing a little bit of intermittent fasting or picking a meal or two in a day where you say, okay, I'm going to commit to lunch being a really healthy meal, or I'm going to commit to dinner with my family being a really healthy meal, or I'm going to commit to bringing my lunch once. So just commit to one positive change per day. Even with exercise, and I know you had surgery, again, I'm not sure what the surgery was for, but it doesn't need to be anything crazy. If you're able to walk, just be mobile. You don't need to be crossfitting or anything like that, just being a little bit active, moving. So getting some walking in is always helpful as well. And so again, I think it's important to remember that we don't have to be super strict all the time. I find that is one of the biggest reasons that people will fall off their diet, is this idea that they have to be 100% strict all of the time. And so there are patients who will come in and say, I've been strict keto for this long and never deviated, and then they just completely fell off the wagon. My stance is a little bit more give and a little bit more leeway there. I don't think we need to be that strict all the time. I think there's always space to enjoy the things that you love, enjoy a meal that you like. It doesn't need to be strict keto for a full year. I usually say to my patients, give yourself 3 to 6 months of pure sort of strict keto, depending on what our goals are, what we're trying to achieve. And then at that point, we introduce a cyclic keto or a sustainable keto, which doesn't feel so rigid for people. And then I find that people are less likely to sort of fall off the wagon, because when we're super strict like that, what I find is people don't just loosen the reins a little bit. What they do is completely let it go, and then have to figure out how to get back to where they were before. So I find if we move into more of a cyclic keto, sustainable, maybe 80% of the time and 20% of the time just enjoy, that's something that people can follow and adhere to a little bit more. So if you're struggling to get back to it, just baby steps, one step at a time, and it doesn't need to be as strict as it was before. So hopefully that helps. Is it okay if we have too many ketones in our system? So it's an interesting question where people get concerned, can I have too many in my system? Can I take too many exogenous ketones? I think last time we did that exercise, we figured it was about 40 servings a day of exogenous ketones before you got into a range that was, concerning. So it's really tough to sort of overdose on your exogenous ketones. Ketones are water soluble. They will come out in your urine if your body doesn't use everything that's there. So they're not likely to accumulate. The only people who need to be cautious there are type 1 diabetics or type 2 diabetics who are needing to take insulin. As long as there's insulin in your system, you will not go into diabetic ketoacidosis. So diabetics would be the only people who would have to be concerned there. But as long as you're controlled diabetic, you're taking your insulin regularly, you're monitoring your blood ketone levels as diligently as your blood glucose levels, then you should be okay. But obviously make sure you're working with your healthcare providers to make sure they said that that's safe for you. How long will the craving last? I think, Paulette, you're going to have to expand on the question. Sorry, I'm not sure I understand. I don't know if you mean how long before food cravings will come under control or be managed when you take ketones. So if you could just clarify a little bit, that would be great. Are there certain foods you shouldn't eat within 8 hours, the 8-hour eating period of intermittent fasting? Certain foods you shouldn't eat within the 8-hour period. Okay, sorry. So in that intermittent fasting window, I think if I understand your question correctly, you shouldn't be eating anything in the window before, obviously. And then in that 8-hour window, it just depends on the diet that you've opted for. Obviously, I'm always going to encourage my patients as a doctor. I'm always going to encourage them to follow a low carb diet. And so I usually encourage my patients, just following a low carb, doesn't have to be keto, and then healthy sort of plant-based fats like the avocados and the olive oils, things like that in that eating window, sort of in that 8-hour window of time. And then when people are ending a really long extended fast, so if you've done, multi-day fast or something like that, then I'll usually encourage ending with broth and then some higher fat foods like some avocado, some eggs. Those things sort of go down a little more easily. I never encourage, don't go get a burger or something like that. You'll probably not feel great. But if you're doing intermittent fasting in that 8-hour window, again, I'm just encouraging people to follow their low carb diet and then eating those high healthy plant-based fats. If you can eliminate or remove some of the grains, that's always great. And then I usually encourage my patients to follow this diet dairy-free. And so I'm usually asking them to use goat cheese or, goat milk, almond milk, cashew milk, something like that, as another option. But again, that's not mandatory for everyone. It just depends what your health goals are. I have a patient that she believes that ketones cannot work for her because she has PCOS. She's had a gallbladder removed and gastric bypass. So no issue with gallbladder removal and taking ketones. So when she says she doesn't think it will work for her, I'm not sure what specifically she means by that, but I mean, if you've had your gallbladder removed, taking exogenous ketones, there's no issue at all. You can absolutely still absorb and have benefit from the ketones. And with PCOS, one of the primary interventions for PCOS is a ketogenic diet. People who have PCOS are insulin resistant, they have high male sex hormones, blood sugar imbalances are likely more prone to weight gain, although not everybody. And so people with PCOS, when I see patients, the first thing I'm doing is having them follow a ketogenic diet. Low carb is the absolute best diet for people who have PCOS. And then research has shown that beta-hydroxybutyrate can actually, for women with PCOS specifically, it can bring those high testosterone levels back into normal range. It helps to manage some of that insulin, and the BHB has been shown in animal studies to actually promote ovulation. Because women with PCOS can have anovulatory cycles, they're not ovulating, they can have irregular cycles. And so beta-hydroxybutyrate has shown to actually be beneficial in that instance. So for her, if she believes it can't work for her, I'm not sure where or why she feels that way, but the research is actually quite supportive of the opposite, especially with PCOS. And with her gallbladder out, it doesn't impact it either way. So feel free to share that information with her, but tell her to talk to her healthcare provider, someone who's familiar with keto, so they can actually guide her and share some of that research and some of the benefits of keto in those instances. Do I encourage carb cycling? Yes, I do. So I do encourage, once people have reached a specific goal, I do encourage carb cycling. And some people feel better doing that as well when they carb cycle a little bit. And then I encourage people to do that again because for sustainability purposes, because nobody is going to be 100% keto or 100% carb free forever. So in terms of just maintaining those healthy habits, I think it's really important to cycle some of those things in. What kind of diet do I need to eat with ketones? So there's not a specific diet that you have to eat with ketones. So you don't have to follow any specific diet really, but again, as a doctor, I'm always going to encourage my patients to follow what I feel is the most beneficial or sort of healthiest diet for them. Usually that's anti-inflammatory. I want people to take out grains because of the inflammatory impact it has on the gut. I want people to take out dairy. So most often I am encouraging my patients to follow a low carb, keto-like diet. So those nice healthy fats, avocados and oils, things like that. and then limiting or eliminating the grains if possible. But again, you don't have to follow any specific diet, but when you do that, you do see greater benefit. Obviously, if you're fueling your body with sort of healthier foods, you will feel better overall. So again, you don't have to follow any diet specifically, but that is often what I encourage my patients to do just for health and longevity purposes in general. Will the keto diet help with fibromyalgia? Also, I have no gallbladder. Again, as I mentioned earlier, if you don't have a gallbladder, you have to take ox bile or else you won't be able to digest or break down fats. And then for fibromyalgia, obviously, the first thing I have to say is that the diet and exogenous ketones are not going to cure any medical condition. So that's the first thing. But part of my practice is dealing with people with chronic illness. So I'm dealing with fibromyalgia, chronic fatigue, chronic pain, Lyme disease, POTS, all of those things. So I'm doing that on a regular basis. And really our foundation for treatment, there's more than just diet, but our foundation in all of our chronically ill patients is the keto diet. And so that's really, I don't say everyone has to be keto, but in my chronically ill patients and all those patients specifically, I'm asking to go keto, full keto. And then they can take the exogenous ketones, and then obviously there's other treatment that we're doing on top of that. Obviously for fibromyalgia, there are sort of other root causes there. In our clinic, there are a lot of people come in with fibro, but there are other things that sort of contribute to that diagnosis. So I would just make sure, work with a functional medicine doctor and make sure that you've been diagnosed with the proper contributing issues that have led to the development of your fibro. So try and find a functional medicine doctor in your area. But yes, keto is sort of the foundation in those conditions, but won't cure the condition. And so that's very important to remember as well. If you aren't doing keto, is MCT still beneficial? Yes, so same MCT, exogenous ketones, even if you're not following a ketogenic diet, you can absolutely still get benefit from that. Can I eat once a day along with my ketones? I don't like cooking or shopping for food. Yes, absolutely. I actually love that comment, because a number of people I've had say, look, I'm not spending hours every Sunday food prepping. You do not have to spend hours food prepping. I don't food prep at all, and I've been keto forever. You don't have to food prep. It's very easy to make modifications to foods that you can buy or order if you're Uber Eatsing and things like that. And so yes, there are a lot of people who subscribe more to the eating once a day. So they're doing sort of the daily 24-hour fast. And then you can drink your ketones in the fasting window. And then I always just make sure that if somebody is doing a diet like that, you have to make sure that you're really conscious about the choice that you're making for the meal that you are eating in the day. It needs to be a really nutrient dense meal. It needs to be balanced. You need to make sure you're getting your proteins, your fats, and things like that into your meal. And some people will likely need to supplement a little bit with maybe a multi, which I give to anyone going keto anyway, but a multi, a B vitamin, magnesium will also, and your electrolytes will probably also very helpful. People with only one kidney can consume ketones. So you have to talk to your nephrologist. I actually touched on that a little bit earlier about the role of ketones and kidney function. So obviously you have to speak to your nephrologist, make sure that they have said it's safe for you. There's no specific reason or contraindication sort of right off the bat, but again, your healthcare provider knows your health history and if that is or isn't a good idea for you. If you get kicked out of ketosis and you drink ketones, will that put you back into ketosis? So yes, it'll put you back into ketosis for that next 3 to 4 hour period of time. But if you're not following a ketogenic diet, obviously when those ketones are out of your system, your blood level goes back down and then you're no longer in ketosis. But if you're normally in ketosis and follow a ketogenic diet, and then you've, had a carb meal or something like that, and you're trying to get back in, it does help you transition back into ketosis, and then you can just sort of keep going from there. That is all of our time for today, everybody. Those 30 minutes flew by. Lots of great questions today. I see a ton that I missed. I will try and come through and answer some of them if I'm able. Sorry I didn't get to all of them. But like I said, I will try and answer some that I've missed. But thank you for joining today. Like I said, it's always my favorite day of the week. So enjoy the rest of your week, everyone. Stay safe, stay healthy.